Welcome to Spread Love in Organizations, the healthcare leadership podcast where we explore leadership with purpose. I'm Naji, your host, joined today by Mona Flores, a physician and healthcare innovator with a passion for advancing medicine and science through artificial intelligence. As the former global head of medical AI at NVIDIA, she helped build and lead a global ecosystem bridging AI technologies into healthcare. She completed her medical training at OHSU, UC San Diego, Stanford, and Columbia, and also holds an MBA and a master's in biology. With experience spanning cardiothoracic surgery, digital health, and investment banking, Mona brings a multidisciplinary perspective to solving healthcare's most complex challenges. She continues to work at the forefront of AI, science, and medicine, focused on scalable innovation that improves patient care and drives meaningful impact. I could go on for hours sharing about Mona and her inspiring journey, but it's much better to hear directly from her. Mona, it's great to see you again and have you with me today.
Thank you, Naji. Thank you for having me here. Very excited.
So, Mona, first, take us through your journey. What moments, decisions, tensions shaped your path from medicine to leading AI in healthcare?
Good question. People think that your journey is planned and from day one, and that you wake up, like you're going up and you say, this is what I'm going to do, and next I'm going to do that, and what have you. In my experience, this is not the case. In my experience, things happen and you react and you pivot and it takes you in many different directions. One decision leads to another. I grew up in the Lebanese Civil War. So for me, my first inclination was I wanted to be able to leave the war and build a life somewhere else. And the fastest path to doing that was being in business. So that's why I studied business in the beginning. And then I came to New York and I got my MBA, and I was able to I joined an investment bank. At the time, it was called Smith Barney. It's no longer. Working on Wall Street for a few years, I realized that is really not my passion. And I decided that maybe it's time that I actually follow what I've always wanted to do since I was little, which was to be a doctor. So I ended up actually leaving investment banking and starting to take courses at UCLA. I moved from New York to California. I was taking all of these courses just to get my pre-meds, because I didn't even have that, and then got into med school, and then I went from med school to surgery to cardiac surgery, and I loved it. It was amazing. It was a great ride. I loved the work. I loved my patients. I loved operating. After practicing for a few years, though, I realized that there is perhaps a more scalable way to helping people, as opposed to operating on patients one-to-one. I realized that if I'm actually able to reach one-to-many, my impact would be greater. At that time, I left the clinical world to start a company with actually one of my patients. And it was in digital health. It was following cardiac surgery patients, making sure they don't get readmitted to the hospital. They do well, what have you. 2 years into it, I realized that actually AI was coming, and AI was a much needed technology for healthcare, even more than just digital health. And at that time, I pivoted and I taught myself a lot about AI, and I joined NVIDIA. And initially, I joined them to work with startups. And then eventually, I became the global head of medical AI at NVIDIA. I was the third person into NVIDIA. So we really built the team from the scratch up. And It was an amazing, almost 7-year journey where we took the healthcare team from 3 people to hundreds, and I learned a lot. It was also baptism by fire. It was a very intense environment, but it was amazing. Technology was great. We met so many different people, so many different startups, so many different companies, pharma companies, academia, what have you. We built amazing projects and products, and decided where we take NVIDIA Healthcare. And then at some point, I realized that I actually even want to do more, and I want to do more with a humanitarian bent. So I left NVIDIA, and today I am advising many different companies as they're using AI to improve their products, to launch their companies. I'm also on the board of several organizations that are either very science-oriented or very technology-oriented. Because in the end, what I would love to be able to do is to leverage this AI into medicine, into healthcare, into pharma, drug discovery. I would be able. I think there's so much more we can do, and we can do it so much better today if we know how to use AI correctly. And I love that intersection, and I just want to take it further. With a big caveat, is like I also want it to be good for the world. So the humanitarian and the mission aspect is very important for me. I know this was a very long answer, but I just wanted
No, well, there's so much to unfold in this, and it's fascinating. Well, you know how fascinated I am by your journey, and it seems like you reinvent yourself every few years, and like few people have the courage to do it. So it's really an incredible journey that you've gone through, like from investment banking to doing all the med school again, to being a cardiac surgeon, and then relearning all the AI and being now one of the biggest leaders in AI, and you've built it out with NVIDIA and now with several companies. And I would say you're rethinking also humanitarian and having even larger impact. Like when you think, because you said like you want something that is AI for good, and you've been at this intersection of AI, healthcare, clinical care, investment. What do you see where the technology really needs to be part of the solution? And how do you see the future when you think about all those different disciplines kind of colliding together?
Yeah, no, really, really good question. And I could go on forever, but I think maybe I will answer it in 2 ways. What is currently happening and is available and we can just improve very fast? What is the low-hanging fruit? And what is the futuristic vision? I think the low-hanging fruit today, and you can see many companies that already went to market and have lots of revenue in this, is things that are improving existing processes with AI, whether it is scheduling, whether it is scribing, whether it is, being able to order things fast, medications, what have you. Anything that we were doing today, we are either doing it manually or we're doing it slowly. AI is a big accelerator. And that is what has been adopted today. You look at all of these companies that are using, instead of human scribes, they're using AI scribes because it's faster and it's cheaper and what have you. All kind of operations, whether it is being able to figure out your inventory in real time and manufacturing, all of that stuff can happen today and is happening. And there's many different, every day there's a new startup, a new company that's doing something like that. But I think the more important one, and the thing that's really exciting, is these AI native companies that are going to come out, and they're not just accelerating or improving or making a current process faster. They're actually reinventing the whole process in a good way. And when I think about that, if you think about drug discovery and the way we did it before, it's like, yeah, today we can sift through many different databases much faster and do simulation faster, what have you. But I think in the future, what we can use with AI is even figure out products or drugs that have never been seen before, have never been conceived. It's not just sifting through databases. It's just it's generating new things that we haven't thought about. In the same token, I think there's like for diagnostics, for improving how we take, imaging, where we take imaging, how do we scale that? Today you have all of these gadgets where you can go and take an ultrasound with your phone. And I think, if you think about, was it Star Trek or the New Brave World or whatever, they had the camcorder. And of course that was sci-fi. And that was like, when was it, Naji? In the 80s? I don't really think that's far-fetched. In the future, we are going to be able to diagnose people very, very early. You're going to be able to tell before disease even sets in that someone is going to be sick. And I think that's where AI for healthcare would be amazing, when we are able to actually change sick care to healthcare, to well care, so that when we are able to prevent disease from ever happening, we are able to let people live a longer, healthier, they'll have a healthier lifespan. When we are able to treat diseases that today we are not able to treat, like Parkinson's and Alzheimer's and mental illness. There are so many things that I'm hoping with the advent of this amazing new technology and how amazing it's doing today with regular things, that it will allow us to actually answer all of those questions in the beginning, and no one has to suffer from disease, and no one has to be hungry, because we're able to figure out better ways to raise crops, to distribute it, what have you. In every aspect of life, of humanity, I think AI is going to have an amazing, and it is already having an amazing impact, but I think that will continue. I just hope that we use it for good rather than bad, and that the good wins over the bad eventually.
If I go there, and I love how you're framing it, so I want to hear more about good versus bad. Well, you were a surgeon, and one thing that always stayed with me, like your tool where you save life as a surgeon can be a weapon in hands of others, right? And I feel like all of these incredible innovations are tools, right, where you can either use them for good or for bad. And as you're thinking about those, you talked about AI native companies, right? Like we hear about AI, everyone is now in the hype of AI. You've been in the heart of it with, including with NVIDIA. So when you're thinking about those innovation coming to life, can you give us some examples of things you're already seeing happening? But then when you talk about cure, or I love how you said, instead of sick care, or like talk about well care and predicting those diseases, trying to even not getting sick. Like how do you see these things evolve, right? Is it just another tool? Are we living, and you lived it as a physician or even with NVIDIA, like all this digital transformation that ended up not being different? Like everyone feels AI is different than that. But can you give us an example of how do you see the future and the evolution, and how am I as a healthcare leader need to adapt to AI, or how should I think about it in the work I do every day?
One thing to think about, if I'm going to think about AI assisted versus AI native, what does that mean? AI assisted is everything that we're seeing being done in AI today, many of it. For AI native, if you ask yourself the question, would this company exist? Would this product exist if there wasn't AI? Mm. And if the answer is no, then that's an AI native company. And so there's a few different examples of that. And the one that really comes to mind is, again, companies that are doing drug discovery using AI that it wasn't done before. And if you take the AI, it cannot be done. Going back to the lowest hanging fruit is like, what is your pain point? What is the biggest thing that is wasting your time, or that's taking away your energy? What is the thing that you cannot scale? All of those things, start with your highest pain point and look out for solutions that actually help with that. And there are solutions out there for many different things, and that's what I would, evaluate and adopt. The other thing, one thing that's also actually that goes back to like when people are developing these AI products, they need to be talking to the physician, able to be talking to the people who are using this, so that they know like what to build. It's like we don't want to go and build a solution just because it's a fancy solution and we can do it when there's no use for it, right? It's like I built this beautiful thing and I'm like, but the users don't care. So you have to talk, you have to figure out what is needed, and then let me communicate that to the people who are building AI, and hopefully they can work together to build something that is useful today. For the most part, also you have to think about scalability. It's like a solution that doesn't scale is not going to work. With all of the limited resources we have in the world today, you have to look at like what can we do with what we have, and make the most of it. Whether it's agriculture, whether it is medications, whether it is space, what have you. So that's the other way to think about it. Is like, is this solution going to be scalable, and who's going to use it?
That's great. And you've operated, obviously, Mona, in the highest levels of innovations, but you kept talking always about impact. And I know one of your chapters, now you're really focused on, you said, the humanitarian impact. So I know you're leading currently the Your Turn fundraising campaign with LabNet. Can you share what this initiative means to you, and why this felt your turn, basically, to step in?
Thank you for asking. I would love to tell you about this. I mentioned earlier that I grew up in the Lebanese civil war. So when this latest crisis in Lebanon happened, it hit me really hard. I was already thinking, it's like, what can I do for the world? And this thing came where it's like, what can I do for Lebanon now? Because of everything that's happening. So I was watching the news all the time. I was getting very upset. I felt very helpless, Naji. And then I decided this, you know what, being helpless and just, feeling bad is not going to help anybody. So I decided to do something about it. Fortunately, I had just joined LabNet. LabNet is an organization of more than 5,000 tech professionals. It started in the Bay Area, but now it's all over the world. And I got to think, it's like, going back to, it's like, what do you have? What can you work with? It's like, we have this amazing big network of people, like website developers, creatives, what have you, everyone that's working in technology. How can we leverage technology to help Lebanon today? So we, and I had just joined the board like 2 weeks ago. And I realized that we could actually use that platform in order to build something to give back to Lebanon. For people who do not know, the Lebanese, we have more than 1 million people that are displaced in Lebanon today. And Naji, that hit me really, really hard, because again, growing up in the civil war, I actually had that. I had to leave, and there was a big problem that was happening. There was a massacre. And I had to flee my house with like in my slippers, with my family, running in the street, to try to escape the locality of what was happening. So when all of these people got displaced today, that just hit me so hard. And I'm like, I know how it feels, and we needed to do something about it. So with all of the LabNet members, we got together and we figured out that we can reinvent the wheel. We can try to get medications to send to Lebanon. We can try to do whatever. But in the end, this is not the first time that Lebanon has undergone such a crisis. We've had this before. We've had it with the port explosion a few years back. So there are already services, already people on the ground who know what to do. They have distribution channels. There's all of these NGOs. You worked in the Lebanese Red Cross. They have the systems. The systems are there and they work very well. What they are lacking is funding. So we realized that if we can actually get funding to all of these people who are doing work on the ground today in Lebanon, it would be a much better way to help. So we talked with 10 different charities that are, we vetted them, making sure they're doing exact work today on the ground in Lebanon, helping with all of the displaced. And we created a tech platform, again, going back to LabNet being a technology company. We created this platform where you can come to our campaign site and you can decide what is important to you in helping. Some of these people don't have food, some do not have toilets, some what have you. So what is important to you to help, Naji? Do you like to actually help with food? Great. We will actually connect you to the World Central Kitchen, where you are able to donate at their site. The same way you would always donate at their site, or Beit el Baraki, or any of the other charities we're working with, and then you would come back and we just ask you to refer people. We are not collecting any money. We are not collecting any data. We are just being the megaphone. The charities are being the engine, and you, Naji, and the people who donate and who refer people are the fuel for this. So let me tell you who the charities are. These are, again, big vetted charities, because we are hoping that this will work all over the world. We have UNICEF, we have UNHCR, we have Doctors Without Borders, Direct Relief, World Central Kitchen, ANERA, I said Beit el-Baraki again, Doctors Without Borders, did I mention that? I think I mentioned that. We have Lebanese Red Cross. We have, I feel like I'm missing one, and I don't want to Save the Children. And then we have Global Giving. And Global Giving is a charity of charities. So they have within them 10 different charities on the ground in Lebanon. The most prominent ones are the Lebanese Food Bank and CCCL, which is the Children's Cancer Center of the AUB. Because again, cancer can't wait, and you can't interrupt. You're a physician, you know that. You stop their care, they don't do very well. So so we have these 10 charities. For the most part, they're all 501c3 charities. You give to them. Your donation is tax exempt. The campaign website is yourturnlebanon.com. Please, please, please go to the website, check it out, share it with your friends, with your family, with anyone that you know. Thank you. Lebanon needs you. We need you.
Well, thanks, Mona, for sharing this. And it's hard to transition to another question, but somehow related, to what you've been doing since very early on, like with all your different work. You've always kind of been at the forefront of having an impact as a leader, and you said you said how you've been thinking how to amplify from one to many, as you said. I love this term. So as you're thinking forward, and as you think about you as a leader and the legacy you're building, how do you think about that, and what is kind of your future self thinking?
Naji, you've heard of the saying YOLO, right? You only live once. And for most people, when they say YOLO, they're saying it in kind of like, oh yeah, like I'm going to go party, I'm going to dance, I'm going to travel, what have you, because you only live once, so like enjoy it. And in my book, and I'm not sure why, but to me, YOLO actually means it's a different thing. To me, of course, you only live once, but what is it that you can do to help humanity, to help the world in this once? That is what's important to me. It's like I have one life to live. I have a lot of energy. I have a lot of skills. I have a lot of things that I could use to actually help this world. And this is what my YOLO to me is. Can I actually improve someone else's life? Can I actually make someone less hungry? Can I actually have a shelter for somebody? Can I cure disease? I have family members, my parents, they both have Alzheimer's. Is that like, I don't want to see anybody sick. I do not want to see anybody in pain. And if I can do anything to help that at scale, that's what I want to do. So what is my next chapter? Something at the intersection of AI and healthcare and humanity. And, I realized actually running this campaign that personally, to me, this is a speed that I like to go at. We started last week and we're launching tomorrow. This is my speed. I only have one speed, and it is go, go, go. As long as I have the mission, that's what I actually do my best work. And so whatever it is that's going to come next, Naji, I can't say what it is, but it's going to be at this intersection, and it's going to be with the same intensity.
Yeah, and your intensity is so needed in this word. I love your YOLO and what you're doing. And again, you're making the world a better place, which is
well, I try. I don't know. I'm definitely trying, or I would love to.
But I'm going to give you now one word, and I would love your first reaction to it. The first one is leadership.
My reaction is like, that's what's needed to get anything done. You need to have leaders who actually can get things done.
What about impact?
The most important thing is the impact, the humanitarian impact you can have on the world.
I have to ask this third one. BioLink.
BioLink is an amazing organization. I'm also on the board of BioLink in addition to LabNet. BioLink is an organization, as you know, of all of these of all of these life science professionals. Our idea there at BioLink is actually really amazing. We would love to be able to actually build a life sciences ecosystem in Lebanon so that we can help. We can have an impact over there on hiring people, on clinical trials, on what have you. At this point, this is a little bit futuristic because of what's happening in Lebanon today. We are unable to do that, but we are actually amassing the talent and the people with experience that will be able to do that. And hopefully very soon we will be able to do that.
And the last one is spread love in organizations.
I love what you're doing, Naji. I love your podcast. I love everything that you're doing. This is talk about scaling. You are also amplifying people's messages and scaling out and spreading love and knowledge everywhere. So kudos to you. I love it.
Oh, thank you so much. That means a lot. Any final word of wisdom, Mona, for healthcare leaders?
Don't be afraid. It's just, if you don't know about AI today, go learn. If you're not using AI today, you're already behind. Just don't be afraid, and just don't get stuck in your old ways. It doesn't help anybody.
Well, thank you so much again for this inspiring chat and for being with me today.
Thank you, Naji. Great to be here. Thank you so much.
Thanks for listening to the show. More episodes in partnership with biolink.org can be found on our respective websites. Make sure to subscribe to spreadloveio.com or wherever you listen to your podcasts. Let's inspire change together and make a positive impact in healthcare, one story at a time.